bronchi, which refers to the bronchi and bronchial airways of the lower lungs, and ectasis, which means a dilation or expansion. So in bronchiectasis, chronic inflammation causes the bronchi and bronchioles to get damaged and dilated. Bronchiectasis is an obstructive lung disease, and that's largely because the inflammation causes mucus plugs to form in the airways, and those mucus plugs obstruct airflow. Normally, when taking a breath, the diaphragm muscles move down and that creates negative pressure within the chest. This draws air in through the mouth or nose, and then down the trachea. Once there, it goes into one of the primary bronchi, or main bronchi, then secondary bronchi, or lobar bronchi, then tertiary bronchi, or segmental bronchi, and finally into the bronchioles, which lead into the alveoli. The alveoli, or just singular alveolus, is where the majority of gas exchange happens in the lungs. Taking a closer look at the airways, particularly the walls of the airways, they've got elastin fibers, which help give them their rubber band-like properties, and are lined with epithelial cells, some of which have brush-like projections called cilia on their surface, and others that secrete mucus. That mucus traps foreign particles, like bacteria and dust, and the mucus then gets swept upwards and out of the lungs by the cilia. Together, this whole system is called the mucociliary escalator. Eventually, that mucus and any stuck particles move into the esophagus, and then get swallowed and destroyed by acid in the stomach. Bronchiectasis results from diseases that cause chronic inflammation. One cause of chronic inflammation is primary ciliary dyskinesia, where cilia don't move normally and that leaves mucus stuck in the airways. Bacteria that's trapped in the mucus starts to multiply, and that can cause a pneumonia. If that happens repeatedly, it can cause chronic inflammation. Another example is cystic fibrosis, where the mucus itself is extra sticky and therefore hard to sweep. Once again, the mucus accumulates and recurrent pneumonias can lead to chronic inflammation. Another cause is airway obstruction, and that might be from a tumor growing within the airway or just outside the airway and sort of pinching it shut. Or it could also happen when a foreign object like a peanut accidentally gets lodged in a bronchiole. In any of these situations, the blockage prevents the mucociliary escalator from clearing out the mucus. And once again, this leads to recurrent pneumonias and chronic inflammation. Also, certain types of infections like aspergillosis can worsen the problem because they can cause a hypersensitivity response which results in even more inflammation of the airways. So the reason that chronic inflammation is so problematic is that over time immune cells and their cytokines can actually damage the ciliated epithelial cells, as well as destroy the elastin fibers in the walls of the airway. Over time, the airways become dilated and clogged with mucus. Fibroblasts then move in to try to repair the damage by depositing collagen. The loss of elastin and the buildup of collagen makes the lungs less elastic and more stiff. The stiff, mucus-filled lungs make it tough for air to flow smoothly, leading to the pattern of obstructive lung disease. That inflammation can also extend to involve the pleura, which is the lining of the lung. And over time, as lung function declines, there can be hypoxia. To adapt to this situation, the pulmonary arterioles start to constrict, effectively diverting blood away from the most damaged areas of the lungs. But if the damage is widespread, then there's widespread vasoconstriction of pulmonary arterioles, and that increases pulmonary vascular resistance in general. When you increase resistance, you increase pressures, and in the lungs, this is called pulmonary hypertension, and that makes it hard for the right ventricle of the heart to pump out blood, and this can lead to right ventricular hypertrophy. And this whole process of right ventricular hypertrophy caused by a problem with the respiratory system is called cor pulmonale. Now, bronchiectasis symptoms like wheezing and coughing usually come and go, and they're worse during a pneumonia when there's more mucus around. Shortness of breath as well as foul-smelling mucus are also common features. And long-term hypoxia can lead to digital clubbing, or rounding of the nail beds. A diagnosis of bronchiectasis is often made based on imaging. Typically, a CT scan will show dilated bronchi and bronchioles. And pulmonary function testing will show a decrease in lung capacity, as well as a decrease in the ability to force air out of the lungs, as a result of decreased lung elasticity. Genetic testing can also be done to look for underlying conditions like primary ciliary dyskinesia and cystic fibrosis. Treatments usually aimed at treating the recurrent pneumonias with antibiotics, as well as using percussion or postural drainage to remove any excess mucus. If there's a physical obstruction like a tumor or foreign body, then surgery might be needed.